Hello everyone, and today I have with me Dr. Shubham Sahni. He's a proud Damsonian and has secured an amazing rank 7
Thank you.
in November AIIMS 2019. So heartiest congratulations, Shubham.
Thank you, ma'am. Thank you so much.
And are you happy about it?
I am very happy. I am like on cloud nine. I cannot believe this. Literally checked my result 10 times. I made my friends check it, made my parents check it, and then until now, now the feeling has sunk in कि हाँ भाई, I have got a rank.
Yes, I'm sure. It is an amazing rank,
Thank
and
you, ma'am.
you've done really, really well.
Thank you so much, ma'am.
That's great. And Shubham, the reason you're here is because we really want to know your strategy. And being a top rank holder, we really want to know what you've done to reach this far. So, to begin with, I would actually tell you that Shubham has been a foundation batch student with us and then has also followed up with a test and discussion course. So, सबसे पहले तो मैं ये शुरू करूँगी Shubham by asking you that do you think that the classroom classes that you've attended had an impact in your preparation?
Definitely, ma'am. The classes are, the real source of learning comes from classes. You must have listened to many of the toppers saying that classes are very important, you must attend classes, but literally they are important. If someone is saying it 10 times, that means it is really true, and you cannot learn. Like, I was a satellite student, still I was able to grasp so much things from the classes, and most of my learning came from the classes itself. I made proper notes. First of all, your own notes are very important.
Yeah.
I made my own notes in the class during my foundation years. Then like in AIIMS, we have a combined third prof. So we have all the clinical subjects being evaluated at the end of third prof. So by the end of third prof, I had all my clinicals, including ENT opthal short subjects, prepared, including the notes being revised twice or thrice. So I was thorough with that.
Great.
Then when I started with internship, during the initial part of internship, I had really hectic postings, the medicine, surgery. So I could not like concentrate much on that. But I had that faith that I have done much, most of the things before only.
Yeah.
So now it will be much easier for me. So I have something to gain in internship only, nothing to lose. If you are working in internship, that doesn't mean that you are losing on the time.
And in fact, I think internship is a blessing in disguise.
Exactly. That's what Deepti ma'am always says, that internship, because of the limited time during internship, you only study the things that are very high yield.
Yes.
And trust me, only the high yield things are asked during the exam.
Yes.
It's not everything that has to be asked in exam. Like one of the pediatrics faculty at AIIMS had written a post that people often say jack of all trades, master of none. So there is another thing to it. Jack of all trades, master of none is always better than being master of only one.
Yeah.
So you don't have to delve into the depths of each subject.
And plus basically you're preparing for an entrance exam to post-graduation. You're not doing post-graduation by itself.
Exactly.
And you can't really do it in 19 subjects. So if you have too extensive things, then you lose track. You don't know how to compile it, how to concise it, and how to revise it most importantly.
And over here only I would like to really add it, that it is really important to attend your clinics and internship postings. See, if you want to go anywhere else, I am not the right person to ask. But if you want to come to AIIMS and crack AIIMS exam, you really have to attend your clinics really well. Like, I always had this habit of going to clinics right from my second prof. I never missed any of the classes, and probably people mock at me and say that इसने तो सबसे ज़्यादा cases लिए हैं clinics में. So that really helps. That builds that subconscious thing.
And along with that, you managed the classroom as well.
Classroom as well.
He's been attending the classes as well. So he's like done the best combination. He's reading, making concepts, and then applying it right from the beginning itself.
Exactly.
Which is so again, I'm coming to that. So now that we come to concepts, and basically being a doctor is about applying your concepts. Right. So you said you've been a satellite student with us. So do you think that it was apt for you sitting there to clear concepts as well, despite that the fact that it is a satellite, it's a live class? So were you able to clear your doubts, clear your concepts, and
Yes, ma'am. Actually, initially I felt some difference between satellite and live coaching, but towards like after few months, I could really imagine the teacher being sitting next to me. Like during my TNDs and my classes, I used to type doubts and send to most of the faculty, including Deepthi ma'am.
Yes, I
And
remember.
and Deepthi, most of the times it was like in TND, if there was one question, I don't exactly remember which question, so I typed a wrong answer. Then Deepthi ma'am said, "Rishikesh beta, how can you do this wrong?" And it was like it hit here that ये तो मैंने ही गलत करा. So
Yeah.
मतलब there is no difference. Seriously, there's no difference. It feels as if you are in a live class only, and ultimately you're making concepts there only. You're not losing anything. You're
And you
gaining.
interact with the faculty, and
And
you
we
get to
can
know
interact.
your mistakes,
True, true.
and we hammer you as well when
Yes.
required.
True.
Right. And now coming to in your internship, when you have made your thorough notes, and you said you've already read them for prof as well. Okay, before I go on to internship, do you think those notes were helpful for professional exams as well?
Yes, ma'am, they were very helpful. Like before every exam, we have like 1 or 2 day max off
Okay.
tops. So during that time, can we read books? No. Can we refer to guidebooks? No. What we need are a good set of notes, and DAMS will provide you that notes. So you have read that notes, you have made your own notes, and you're revising it again before the professional exams. So you're like hitting two targets at one time only.
And you're being consistent right from the beginning. And now we
Exactly.
also actually have practical courses.
Yes,
So you
ma'am,
can
I've heard.
duplicate those things as well. You could see the practical cases here in the eMedico's app, and then
And
you
then
can see them
go-
on the clinics
yeah.
as well. And
True, true.
so that's a good amalgamation. Now coming to your internship, when you know that it is hectic and time is less. So most importantly, I'll start from here now. How did you plan at the beginning of the internship? That is going to be my first question to you.
So actually, I made a big mistake during the starting of my internship, that I thought that I have busy postings, so I might just as well start late.
Okay.
But I would like to advise all my juniors and all those budding people who want to come to AIIMS or any other college, start right from the first day of internship. Right? You should. My advice would be that you must, it's not you should, you must join a test and discussion course, because it's not that questions will come directly from the test and discussion course, but the discussion and the environment will, like the constant hammering, it will build concepts, and you will feel more confident while giving the exam.
And it also gives you a good idea on what topics are most likely to be asked.
That is the most.
See,
I
it's
forgot
never
that.
going to be verbatim things.
Exactly.
So
That is most important. Like
because in the internship, when the time is less, you again cannot read everything, as you said.
Exactly,
So you
exactly.
should know what you should give priority to.
Exactly. And if suppose there are 75 questions in a test and discussion, say OBS TND, then those 75 questions will give you 75 topics or max 70 topics. So you can read those topics. Not even 70, there will be lesser than topics. You can
Yeah.
read those topics as a ready reckoner, and most importantly, they will help you just before the exam. So during my last 15 days or so, I had very busy postings. I had casualty postings. I was running here and drawing samples and everything. It was very hectic during that time. But still, I knew that I had an off later on after the night. And during that off, what I have to do is refer to the TND notes.
Okay.
And they are very crisp notes. You can revise them, so your subject is done. So that's how I planned during internship.
So in the beginning, you started to simply follow the test schedule.
Test schedule.
So you used to read in the week.
Week.
अच्छा, बहुत सारे बच्चे ये भी जानना चाहते हैं, the week before the test and discussion, what exactly did you read? Was it your notes again?
Primarily, it was the notes.
Okay.
See, I'm not a very MCQ type of person. During my from the starting of my second year itself, I had decided that I'll build more of concepts, less of MCQs. Because trust me, MCQs are not going to be repeated. If at all they are going to be repeated, is the previous year or the topics that are going to be repeated,
Yes,
not the
yes.
MCQs per se verbatim. So what is more important is that you read the notes during that 1 week. So if you have 1 week, like say there was a test today, tomorrow read that topic, read that test and discussion, or just go through it if you don't have time,
Right.
so that something gets into your mind, because you must have read it, listened to it properly during the test only. Then so you have 5 days more left or 6 days more left. During that time, divide it. 4 days read the notes.
Okay.
Second last day, revise those notes in a very quick manner again.
Okay.
And then just the day before the exam, try to do some of the MCQs if you have time, of that subject only, or of only the supra important things. Or if you want to refer to, say, if you have marked some things in Harrison or Robbins, you can go through those things rapidly during the last day, because what happens is that just the last day before the exam you are like on your nerves कि tomorrow there's an exam, अब बस पढ़ना है, बस rank लानी है कल. तो it मतलब you can read many things during that time. If you sit back and say कि आज मुझे हैरिसन का ये topic पढ़ना है, you will keep on reading, but just before the day before the exam you can only look at the high yield things and all the important things. I was not able to do it for all these subjects, but if you can, that would be a really good idea, I think.
And in especially when you talk about interns, and suppose you're not able to give the test, but you really want to do the discussion. So the advantage is that the test is already uploaded in the eMedico's app, so you can give it before and you can come for the discussion.
That is a very good thing that has been started. So if you I missed 3 tests, I could not go through them, but now you have them online, so you can look at them directly. Yes, you will
also from this year we will also be giving the same discussion access on the eMedico's as well, if you sort of miss a lecture of a TND.
That is really good.
Okay, so now also I would want to ask, क्योंकि हम अभी शुरू की बात कर रहे हैं internship की, did you give grant tests right from the beginning?
No, ma'am. I regret that I did not give. Probably I should have given. But ठीक है, now what has happened has happened.
And it has happened well for you. So
yes. So मतलब it's good to give grant tests. मतलब my seniors were constantly telling me कि give grant tests from the beginning. Deepthi ma'am always in all her मतलब videos she says do grant tests, do GTs, do GTs. I thought क्या मतलब if you have not read, what is the use of giving GTs? So towards the end, I started giving few grant tests, and then when what I realized is that it not just helps you in your time management and everything, which is very important for AIIMS exam, but it also helps you to get to know about the most important topics.
Yes.
Because like for example, professional exams, if some topic had been asked, say brachial plexus has been asked in your mid-semester exams, you will definitely read that topic for your profs and your pre-profs, right? Similarly, if some topic has been asked in your CBT or your GT, you will definitely go back and read that.
Because you know that there is a reason why it has been put in the paper.
So that is the topics thing and the time management things. So you should try to give as much GTs as possible, obviously with the same frame of mind, not giving GTs every day. So that is also not of any use.
Because it can't replace your theory content. You have to be thorough. But then yes, MCQ practice, and especially as he has been mentioning, the most important reason is to know what topics are the most important ones, so that you know what to read towards the end.
True.
Right. So now I'll come to the middle of the internship. Did you change your strategy, let's say halfway down, and what was your priority then, or how did you go about from then on?
Actually, as I told, I started test and discussion a bit late. So I started at around May or June, which is very late if someone would consider that this is very late for starting an exam, AIIMS exam preparation properly. Before that, I was reading, but very little bit during my hectic postings. But then when I actually got time, I started to religiously give the test and discussions and study from that point onwards. So please remember, it's never late to start, right? You can start at any point and you can do wonders, and no one can reiterate it better than me, because I started very late according to me, and then still it has turned out fine. So I started late, and then I started religiously following the test and discussions. The test and discussion ended at around October end or something, or October mid, I guess. Then from that point onwards, I started revising the notes, and for the longer subjects, the TNDs should be revised, and for the shorter subjects, you can go through the notes as well. And please don't focus much on MCQs. It is your call if you want to do MCQs or not, but you should concentrate more on the theory aspect, because that will help you more in the long run, right? Because there were few friends of mine who only did MCQs and all, but that did not work. And I have done theory, and a few of my friends have done mainly theory. I'm not saying only theory. So that turned out really fine. So I would say that so start giving prepare religiously for the test and discussions, then start blindly follow DAMS schedule. They have kept some topic or some subject as for 3 TNDs or for 2 TNDs for a reason. There is a reason why Obs Gynae has 2 TNDs while Ophtha has only 1 or 2. There's a reason why medicine has 3 TNDs. So give that much amount of time only to that subject, not going haywire. So TND ka most important aspect is that it gives you a schedule. You keep on following that schedule.
So you're always on track.
Always on track. You keep on following that schedule, and when that schedule ends, now your own call has come. Now you have to start preparing and revising at your own pace. Revise the things that are most important. Revise your TNDs. And
Sorry, I'll interrupt you a little.
Sure.
आपने बोला बहुत अच्छा बोला that you revise what is most important. So ये बच्चे बहुत बार हमसे पूछते हैं मैम आप ये बार बार बोलते हो but इसका मतलब क्या है? So can you elaborate a little? How did you decide what is most important?
like say for example, let us take a subject, say physiology, right? Physiology is very vast. You have your notes, the notes have everything. You have given your TNDs, there are 2 TNDs for physiology. You have given those 2 TNDs. You know that if nerve and muscle is being asked, more questions are there for nerve and muscle, that means it is important, right? You already have, if you don't even know, you have that subconsciously in your mind that these topics are important.
So if I put it in short, although he's been saying it, but I wanted to, sort of put it right there. So again, he's used his papers to understand what is most important, right? So the TND papers, the GT papers. So that's how you get to know what is most important. So please do look up your, the topics that have been covered in the TNDs and the GTs and the CBTs, and they automatically become the more high yielding things that should be tackled first in your revision. Now you can carry on.
One more thing I would like to add. Please don't forget your standard textbooks, please. Like, आजकल people are like running after guidebooks, or not even guidebooks, मतलब after any institute material, and they are like कि this thing will suffice and अब मुझे कुछ पढ़ने की ज़रूरत नहीं है. Please don't go blindly after that. You have to read your standard textbooks. For some subjects,
especially during your professional years.
Exactly, only during your professional years.
Yes, you can't do it in internship, but you
No.
must do it, side by side, make your concepts clear, make your base strong, and build your base on those textbooks.
Like for some subjects like OBS and Gynae, you can blindly refer to Deepthi ma'am's
No,
notes.
but once you should read your standard. It gives you a good feeling.
It gives you a good feeling, right? Like when you're going through shows. So there are the procedures over there. There's a separate chapter on gynecological procedures. Then there are surgeries that are explained. So it gives you kind of feel that you are really a doctor. See, no one is going to ask you when you're going to pass out, ki what is the most common cause of this, or what is the most common organism implicated in this, right? What will help you in your exams, PG exams, as well as later on, will be the standard textbooks. So like I used to have Harrison Sundays. Like for example, I used to really like, Harrison is one book that I really like, and probably that is why that has developed my interest for the medicinal aspect and not the surgical aspects. So what I used to do is like, for example, if there's some topic taught in college, or before that I would like to add one more thing. Like for example, if Harrison has like 47 odd chapters from cardiology, how would you know which chapter to read? Many people think that पूरा Harrison पढ़ना है.
हाँ, वो back to back नहीं
पढ़ सकता. So what you do is that you attend your classes, right?
Yeah.
You in the classes, suppose infective endocarditis has been taught, ARF has been taught, the mitral valve disease, aortic valve disease, these have been taught. Now what you do is that you read only those topics from Harrison on a plain Sunday. Go to the library,
and
read that topic.
We've made that part also easier. We have Harrison-based discussions in the Medicos app itself, where the teachers, the medicine teachers, are actually discussing the Harrison topics exactly from the textbook itself.
Exactly. And then one more thing, add those things, extra things to your notes, right? Don't add too much, don't add too less. Add moderate amount of things to your notes and revise that also. So what will that help? That will give you an edge over the others. See, even if you have read Harrison, you will not be able to recall those things. Like
neither
what you
revise
have read.
It in the internship.
Neither revise it. So if you have added something in your notes, right, it will serve 2 purposes. It will subconsciously enter your mind, number 1, which will help you in solving the guess questions that are said so. And second thing, that will also give you an edge over the questions that are directly coming from the textbook if you have added them in your notes. So you should like read a little bit of standard textbooks also. Please don't go blindly after reading the guidebooks or only studying the coaching material, right? Please also read the standard textbooks and again attend the clinics.
Right. And now coming to just close to the exam. So now close to the exam, what material did you use?
Okay, ma'am, close to the exam, as I said, I had casualty postings, so it was a bit hectic.
Yeah.
So I only during the first 10 days, I studied the TNDs. Okay. Now again, you will not be able to revise everything, towards the end. So what would be better is have group studies. I had a very good study partner with whom I used to revise everything quickly. Like if I'm stuck on one topic कि ये रट लेते हैं, so he used to say no, फटाफट खत्म करना है, quickly. So that gives you a pace. Group study always helps towards the end. So you should try group study towards the end. So then do the TNDs. Then during the last 4-5 odd days, you can again do the TNDs which you think are volatile, or what I would advise is there's a very good thing, AIIMS capsule, right, on the eMedicos app. trust me, that is a treasure. Like there were so many questions directly from there. I could literally, while solving medicine questions, I could hear Arvind sir saying, this is PSUT, this is MAT, and those questions came in exam. So do the AIIMS capsule during the last 4-5 days, and during the last one day, you should do DVT. Like there are DVT review videos, so don't make notes during the DVT, just watch those videos. There was a tough resistance. I was talking to ma'am about DVT videos and all, but DVT videos are really a treasure. And quickly, if you are traveling to some other city, like I was traveling to some other city for giving the exam, you watch those DVTs during that time.
And they're short videos. That's
and they're
the
short
purpose,
videos. Exactly, that serves the purpose, and it gives you a boost कि radiology 6 minutes में खत्म. मतलब खत्म. So it will help you in that thing. So that's how I prepared during the last few days.
Okay, that's great. And you've given the CBT as well.
Yes, ma'am.
So how did that sort of help you in the preparation of the exam day?
Ma'am, that one thing that really helped me after giving the CBT was my friend, my study partner, and I both had given the CBT. So in the CBT, my friend had attempted much more questions. I had attempted lesser. I was more of defensive.
Okay.
I got a worse rank than him.
Yes.
That made me realize that
you can't go defensive.
We cannot go defensive, especially in the single best response in AIIMS this time.
Yes.
You have to be on the attack mode. I only left, I guess, 1 or 2 questions in the single best ones. So that really helps. And also second thing, it teaches you time management, right? If I would have given more GTs, like I left 4 questions in the AIIMS exam because I did not have time. So I think कि if I would have
done even 2 of those, then 7 से क्या हो जाती rank?
But no, that's like okay, that is one point. But more importantly, that would have regret नहीं रहता कि I would have left. I have left those questions.
Actually.
So give GTs or CBTs not with the intent कि इसी में से उठ के आएगा. With the intent that I'm going to learn time management, I'm going to get to know about the important topics, and that will really help you in the long run.
Which subjects are you weak at, so that you can focus on them?
Exactly, that also. It gives you a detailed analysis कि ये तुम्हारा weak है, this is weak, so you focus more on that. So that is very important for that.
Right. And now, Shubham, if we summarize and I ask you, what do you think are the key ingredients that somebody would need to crack a rank like 7 in AIIMS, which is awesome? What would you say to them?
I think 3 things: concepts, clinics, and internship. मतलब concepts you'll get from class, from TNDs, or from coaching material. Right? Clinics you'll get from your hospital. Internship you get in your internship. And 4th thing, revision. If you have all these 4 things, you can get any rank that you want, any stream that you want. So I think that perfectly summarizes it.
Great. And what stream do you want to pursue?
Ma'am, I'm a bit confused between medicine and pediatrics. Okay. So I'm confused between that. And I'll decide.
He'll decide.
But before ending, I would also like to thank
Please go ahead.
all the people who have made a difference in my life, especially my parents. Like I had almost lost hope कि नहीं होना इस बार. I had almost decided, मम्मी को बोलता था कि एक room खाली कर दो, मैं आके तैयारी करूँगा 6 महीने. But then my mom said that no, you will do it, beta. You are a star child. You have done until now, तुम अभी भी करोगे. And that really motivated me. My seniors who are there at PJ Chandigarh, AIIMS New Delhi, they constantly motivated me कि you can do it. You have done till now, you can do it. My friends, my study partner, all the SRs and JRs at AIIMS Rishikesh, like they really helped and made a difference. And especially the faculty at AIIMS Rishikesh is superb. So I would like to thank everybody, and especially I would like to thank Deepti ma'am and Sumer sir and all the DAMS faculty, and especially Siddharth sir for PSM. You are a fab person, sir. Your teaching is like fab. I'm sorry if I'm forgetting any teacher, but all the teachers are fab. But Siddharth sir, Deepti ma'am, Sumer sir, Anupama ma'am, like everybody, Diksha Sikri ma'am, Sanjeev sir, everybody, they're like perfect. I really had a really nice learning experience. Look, so if I'm joining any stream in any college, I'm not just going there with a rank. I'm going there with knowledge, right? That knowledge which has been gained by my own self-study as well as DAMS. So I guess that perfectly.
And it will go a long way. Yes,
yeah, it
your
will
hard
really
work
go a long
will
way.
really pay off.
You're going to become a doctor.
Not only as a rank holder, but as a good clinician.
As a good clinician, right? So
right.
I think.
So heartiest congratulations once again,
much,
Shubham. That was a wonderful advice to people who are listening to you, and I'm sure they'll be able to grasp a lot of points from that and incorporate it into their own study schedule. And the entire DAMS family wishes you a very, very bright future ahead.
Thank you so much,
lots of success in whatever branch you pursue, right? So
thank you so much.
Thank you so much once again for being here.
Pleasure.
And it was a pleasure as well. Thank you.
Thank you so much.